There's a silent killer nearly 50% of people don't know about until it's too late. But here's the good news. You can uncover this risk for only $40. And here's the even better news. There are simple, practical steps you can start taking today to lower your risks and avoid cutting your lifespan short. In this video, I'll explain this hidden risk, why a $40 purchase might be one of the best investments you can make, and the simple, practical steps you can start taking today to control your long-term health. So what is the silent killer? Well, a major study followed 10,000 young men over 25 years, and it was able to connect one simple measure at the beginning of this period to a massive increase in the risk of death, and that factor was their blood pressure. Compared to those with a normal blood pressure reading, the estimated lifespan expectancy was shorter by up to 12.2 years for those with the highest blood pressure levels. So what's going on here? Why is blood pressure so significant? Well, to answer this question, let's start by recalling what blood pressure is. Your heart is a pump whose job it is to circulate blood through your body, carrying oxygen, nutrients, and many other important things to your cells. Your heart creates pressure in your blood vessels as it moves blood through the system. When we measure our blood pressure, we're measuring how strongly our blood is pushing against the walls of our arteries. Just like with a hose or a pipe, if your blood vessels are asked to carry too much pressure, they can be damaged or even rupture over time. Damage to your blood vessels is so dangerous because it can lead to heart disease, heart attacks, and stroke. But it's dangerous for another reason too. I called high blood pressure a silent killer because it often doesn't have any symptoms. If you think about the nature of heart attacks or strokes, they are sudden events that for many people it happens without warning. Even though the damage that's led to them having that heart attack, it takes place slowly over decades. According to the World Health Organization, an estimated 46% of adults with hypertension, which means high blood pressure, are unaware that they have this condition. This means that there's a metric with huge implications for our health, our blood pressure, that many people don't realize is sitting at a dangerous level, silently causing stress and damaging their most important bodily systems. And the best way to defend yourself against a hidden killer is to find a way to see it. So how do we do that? Well, you might be thinking, simple, I get my blood pressure checked when I go to the doctor, but there are multiple problems with that approach. So here's a common example that I see all of the time at the clinic. We recently had a patient whose blood pressure measured much higher than I would have expected. She was young, athletic, and lacked many of the risk factors that can raise your chances of having high blood pressure. So as I talked with her, she explained that she often feels super nervous around doctors. And guess what? When you're anxious, your blood pressure rises. So the measurement we took of her in the office wasn't accurate. This problem is so common that it even has a name: white coat hypertension. So you'll get the most accurate blood pressure measurement when you're in a familiar environment and feeling relaxed, like at home. That's why most expert panels recommend that patients get an at-home blood pressure monitor to confirm their blood pressure readings. There's a second reason though why relying on measuring your blood pressure at the doctor's office might not be your best strategy, and that's frequency. So think about this. How often do you actually visit the doctor in a normal year? Probably not that often. Ideally, you want to have a way to measure your blood pressure more often, especially if you are actively taking steps to try and lower it so you can see what is working and what isn't. So both of these reasons are why I always recommend to my patients that they get a device for monitoring their blood pressure at home. But you need to be careful when choosing a device. Accurate readings here are critical, and the market is unfortunately flooded with low-quality options. Instead, look for something that is easy to use and, importantly, has been tested by an independent agency to ensure that the results that you get are accurate. One option is the iHealth Track, which I'm not affiliated with in any way. It's available on Amazon for under $40, and you can see a link to it in the pinned comment. A recent study found that it met the standards set by the European Society of Hypertension and is suitable for use in the general population. It's simple to use and understand, and even lets you keep track of your measurements using an app on your phone. Now again, I'm not affiliated with them in any way. It's just an example of the types of things to look for when selecting an at-home blood pressure monitor. And given the significance of blood pressure on your health and the benefits of being able to monitor it conveniently and accurately, this could be the best $40 you'll ever spend on your health. Monitoring your blood pressure is essential, but maintaining a healthy blood pressure level is even more important. So while you wait for your blood pressure monitor to arrive, I'm going to tell you about 5 practical lifestyle changes you can make starting right now to maximize your chances of keeping your blood pressure at a safe level. There are many factors that determine your blood pressure, and some of them you've got no control over, like your age and family history, but there are plenty of things you can do to lower your blood pressure, and one of the most simple is to reduce the amount of salt that you're eating in your diet. Your body doesn't need much sodium, which is contained in salt. The American Heart Association recommends that we should have no more than about half a teaspoon, or 1,500 milligrams per day. Compare that to the roughly 3,500 milligrams that the average American eats daily. So how significant is sodium intake? Well, one study looked at 85 different trials and it found a clear pattern. As sodium intake goes up, so too does blood pressure. And the reason is simple. Sodium, it causes your body to retain more volume in your blood. And if there's a greater amount of fluid in your blood vessels, that makes sense that it would add to the pressure. It's similar to the way that a balloon stretches tighter and tighter the more you blow air into it. So if sodium is so significant, how can we cut back? Well, the easiest way to significantly reduce your sodium intake won't surprise you. It's to stay away from processed foods and certain categories where sodium intake is especially high. One study in the US found that bread, pizza, soups, and burritos were the top 5 contributors to sodium consumption. So what should we be eating instead? And that brings us to the second practical step that we can take to promote a healthy blood pressure. Researchers developed guidelines called the DASH diet, which stands for Dietary Approach to Stop Hypertension. It's a bit of a mouthful, but it's an accurate label. The DASH diet has been found to be the most effective way to lower blood pressure without using medications. And the DASH diet is simple. Choose non-starchy vegetables, whole fruits, low-fat dairy, whole grains, chicken, fish, and nuts, while cutting out sweets, sugary drinks, and fatty cuts of red meat. And as an added bonus, if you follow the DASH diet or a diet similar to the DASH diet, you're more likely to increase your intake of potassium through potassium-rich foods like spinach, bananas, peas, and beans. Why is this a bonus? Well, because potassium has been found to help lower blood pressure. It balances out our sodium levels while also encouraging the walls of our blood vessels to relax. The third practical step you can take to lower your blood pressure is limiting your alcohol intake. Along with raising blood pressure, alcohol wrecks our sleep quality, so you'll likely see a significant reduction in your blood pressure by cutting back. The fourth recommended lifestyle change to lower our blood pressure is adding exercise. Now, I know how hard it can be to get started, especially if you've been relatively inactive, but the good news is that even small changes can make a positive impact. So I encourage all of my patients to start and look for ways where they can add movement into their daily schedule. So viewers of this channel will know I'm a huge fan of exercise snacks. Exercise snacks are short bursts of physical activity that we can fit in throughout our day. So for example, at the clinic, after I've seen 3 patients, I have a 15-minute paperwork break. So before I start on my paperwork, I do a set of push-ups to near failure or sit-ups. And since I only do 1 set, I don't have to worry about breaking out into a sweat. And the great thing about exercise snacks is that you don't need a lot of time or special equipment. Just find small movements and soon you'll notice your blood pressure starting to improve. So grab those tiny opportunities to stay active throughout the day. Finally, for overweight individuals, weight loss can be a powerful way to lower our blood pressure. One study, for example, showed that the greater the weight loss, the greater the reduction in blood pressure, and I've got other dedicated videos to weight loss on my channel. But now you know about the hidden risk to your health that so many people overlook, and the $40 investment you can make to avoid being in the dark and make practical changes that you can make to maximize your chances of maintaining a safe, healthy blood pressure. But one thing I haven't talked about is the perfect blood pressure target that we should be aiming for. So make sure to check out this next video here that explains how a once healthy blood pressure is actually dangerous and how the guidelines have changed. And a massive thank you to all of the Patreons supporting the channel.